Yes, ma'am.
Okay, so if you've read and understood, considering it critical care scenario station, please tell me, how would you manage this patient?
As this is a critically ill patient, I will manage the patient according to critically ill surgical patient protocol, and I will go for ABCD approach. I will keep the patient nothing per oral, and I will start IV fluid, and I will give IV proton pump inhibitor, as well as
And patient has, yes.
And according to patient's condition, I will go for operative management after patient is hemodynamically stable. And I will go for exploratory laparotomy. Um, uh, as my provisional diagnosis in this case is it might be perforated perforated peptic ulcer disease. I will if I according to finding perforative finding, I will repair the perforation, and I will give omental patch, and I will do thorough peritoneal toileting. I will keep a drain, intra-abdominal drain, and if in case I find any gastric ulcer perforation, I will take a biopsy to exclude malignancy.
All right, okay, thank you. First of all, patient was taking non-steroidal anti-inflammatory medications, drugs, okay? So
Yes.
if a patient has a long history of taking these medications, what are the possibilities? Which organs, okay, now you are thinking about the differential diagnosis, which organs are most likely to be perforated? Or there
Most
could be,
likely, given
yes,
it might be duodenal ulcer perforation.
yes, duodenal ulcer
Most
or
common.
gastric ulcer perforation. So
Or
there are
gastric ulcer.
yes, there are two options in your mind, two differential diagnoses you'll keep in your mind. Okay. And you've done instantly chest x-ray and there was gas under the diaphragm. What does this show you? So there is perforation. Patient
Yes.
needs to be taken to operation theater immediately. So once you receive this patient, immediate your management should be that you'll inform the operation theater, you'll arrange the blood for the patient, you'll give the fluid to the patient immediately. So A, B, and C. Patient
Yes.
was in semi-conscious condition, patient was not responding to you, so you did not complete the ABC as you mentioned you will. Okay, right. So so now I want you to tell me the pathophysiology behind how these non-steroidal anti-inflammatory drugs, they cause peptic ulcerations.
It causes impairment of the protective barrier property of the gastric mucosa, and it has an irritant.
First, this is number one. This is
Mucosa.
number one.
Okay.
First, irritation. This is number one. Yes.
And then the loss of protective barrier,
Yes.
and
This is
then it
number
will
two.
decrease the
Then,
synthesis of prostaglandin
yes.
by inhibiting cyclooxygenase 1.
Yes.
And it will decrease the gastric mucosal blood flow, and it
Okay.
will cause impairment of healing of superficial injury.
Yes. Good. Okay. Now that you have taken the patient to the operation theater, what are the management options available for you? Surgical. Yes, please.
Operations.
One, you told me a mental patch repair.
Mental patch
Then,
repair. I will give thorough peritoneal toileting
very
and
good. And
keep an abdominal drain.
yes,
And if it's a gastric ulcer, I will take a biopsy to exclude malignancy.
very good. So these are these. Okay. Post operatively, how would you take care of this patient?
Postoperatively, I will give long-term proton pump inhibitor in this patient.
And would you or would you not consider
lifestyle
giving
modification.
antibiotic? Would you or would you not consider giving antibiotics to the patient?
I will not give NSI to the patient, non-steroidal anti.
No, I asked antibiotics. In which conditions would you consider giving antibiotics to the patient?
In case of late presentation, in case of gross peritonitis.
No. No. Okay. What is the action of or the mechanism of action of protein pump inhibitors? Why would you consider giving protein pump inhibitors postoperatively?
Proton pump inhibitors irreversibly bind with the hydrogen potassium ATPase enzyme, and it will block the secretion of hydrogen ion from the parietal cell that will bind with the chloride ion in the stomach or within the lumen to form the hydrochloric acid. By this, it will decrease the acidity.
What is the function of hydrochloric acid in the body? Why do we need it?
Hydrochloric acid is an important. It's important to convert pepsinogen to pepsin. That will help in protein metabolism. It will help in absorption of calcium and iron from the stomach within the acidic pH, and it will cause release of cholecystokinin and secretin from the small gut duodenum, and it has antimicrobial property as well.
Yes, good. So what are the phases of motility? What is your aim in this scenario?
Sorry, ma'am, I couldn't answer.
What are the phases of motility, like gastric motility, esophageal motility? What is your aim? You're targeting at which phase of motility?
Okay, I will target the gastric phase.
Okay, why?
Because 60% acid is secreted within the gastric phase.
Okay, right. So please tell me, right, if you have to consider the operation theater listing priority, there is one term which is called what? And according to that term, this operation of gastric ulcer perforation is considered immediate, urgent, priority, or elective.
It will be urgent priority.
Okay. What are the examples of surgeries which are operated on urgent basis? Urgent or immediate?
Some other examples are like fracture, fixation of fracture.
No. The immediate one, like right away you'll take.
Abdominal aortic aneurysm.
Yes, and if you have to do something urgent, what does it mean? That you can perform it.
I will have to do it within hours of making decision.
Yes. Can even be done during night or like appendectomy, like this one.
Out of duty hour, yeah.
Yes, good. Please help me and read this X-ray.
This is a chest X-ray PFU showing free gas shadow under the right dome of diaphragm.
Yes.
With elevated right dome of diaphragm. There is trachea centrally placed, and both lung fields are normal.
Yes.
And bony thorax is normal.
Yes.
And cardiac shadow is also normal.
Yes.
And there is visible funding gas shadow under the left dome of diaphragm.
Good. And what about the exposure? Are you happy with the exposure of the X-ray?
Yeah, there may be lack of exposure.
Good, thank you.